Hello, this is Lumen May, County Commissioner from District 3. I'm here with May's Message. Today I'm joined with Dr. Michelle Greer Hall of Community Health, my longtime partner for the last 2 months in getting information out. And today we have a special guest, Justin Labrato, Chief Medical Officer for Ascension Sacred Heart. Welcome, Justin. Welcome, Michelle.
Thank you so much.
Thanks for having me.
Good. Well, Michelle, we're going to start with our guest today, and we're just going to start with Justin. And Justin, we know that you've been doing a lot of work at Sacred Heart in testing. Out of all the medical providers, I think Sacred Heart and Ascension were the first testing site that came on board, and you've been instrumental in what I believe in mitigating the spread and education and testing. So, are there any updates, or what's the latest information on COVID-19 from your perspective?
Yeah, absolutely. So we're still doing the drive-through testing in Pensacola, and we started on March 16th. So we're in our 8th week right now. We've tested over 6,400 people so far in Pensacola, and we have tested about 60% of the Escambia and Santa Rosa County people tested so far. Between the drive-through and our nursing home testing, we've identified about 350 COVID positive individuals. The drive-through testing is running about a 5% positive rate, and the nursing homes are up between 13 and 14%. But good news is last week, excluding the nursing homes, we were running under a 2% positive rate, which is one of the lowest rates that we've seen in the last 8 weeks. As far as the results, because that's important, getting the results back timely. We're running in-house at Sacred Heart, and so we're getting the results back within a day. Even when we have to send out in the past to Quest in California, they're down to 3 days, which is great news. And then, testing, UWF, the state started their site there. They're going to be there for 2 weeks. They started that on Friday, and we really appreciate them because my team really needed a weekend off. And so this past weekend was the first time my team was able to get a week off, or a 2-day weekend off since February. So we appreciate the state for stepping in there. But, as far as testing, one thing that's starting up this week is we've started elective surgeries at the hospital. And so one of the things to safely do that is we're COVID testing all of the surgical patients. So that's going to add into the volume too that you see us testing in the Pensacola area.
Justin, I mean, if someone's watching this, they may not be familiar with elective surgeries, and those were postponed. Can you talk a little bit about elective surgeries and why they were postponed and why we've continued to bring them back?
Yeah, we were first, it was about the safety for our patients, our doctors, and our staff that we canceled anything that was not emergent. We wanted to keep as few people coming through the hospital as possible. We were anticipating a potential surge of patients for COVID-19 positives. So anything that was not urgent or emergent, we delayed. So if I needed to get, if I've got a broken leg, they're going to take care of that immediately. But if it was something that you could postpone, we were going to postpone it. So we've opened that up this week, and it's going to be a slow ramp up for all the hospitals, because now we have a backlog of 8 weeks of surgical or office visits or labs. There's a lot of medical procedures that need to be done. And the one thing that we're trying to do is make sure that the community knows we're going to do that safely, and that we're putting all the provisions in place to make sure that they're comfortable coming back to the hospital and having those things done.
Well, thanks, Justin. I mean, thanks for that clarification. And we know that we've reached our peak, and Dr. Greer Hall and I talk about this a lot. But do you anticipate any surge, or do you feel like we're out of the woods here in Escambia County? I know people are listening at national news and across the country and reading a lot of the publications. But for the people that are watching this that are here in Escambia County and call Pensacola their home, I mean, how do you feel? I mean, we know that we still have to practice the social distancing and physical distancing, but do you feel like we're out of the woods, or do you think that there's more work to be done?
I think there's always more work to be done, and you said it exactly right. The social distancing, the testing. The state really wants us to test 2% of the population each month. So I think that's going to be key, that we've got to keep the testing up. Community Health, Northwest Florida, and Sacred Heart combined have done 80% of that testing, and I know neither one of our organizations plan to stop, which is going to be great. But I think we are in a much better spot than some other communities. I'm over a medical group in Mobile, and Mobile's completely different animal than Pensacola, than Destin, than Panama City, than Jacksonville. And so I get updates daily from all of those. And I think Pensacola's in a good spot, with the one exception being the nursing homes. And that's that one outlier. You know, we've had 2 spikes in 2 weeks in nursing homes, and hoping that we can keep those down, I think we're going to be in a pretty good spot.
And I'm glad you mentioned the nursing homes, and I'm truly concerned, and I'll be talking about this on Thursday with my colleagues to some degree, that the nursing homes, just because it's contained in a nursing home, doesn't mean it's really contained, because of the workers. I mean, the delivery people who deliver to the nursing homes, the CNAs, the RNs, the medical support team, they have to engage and go to Publix and Walmarts. And so it should be a concern for the entire community, as long as we have a concern in the nursing homes.
Yeah, absolutely agree.
And with that, I know that you guys are working on an antibody test. I mean, to expedite things. How's that going?
So Sacred Heart, our lab, Quest and LabCorp started antibody testing last week. I think we've only done 24 or so here at Sacred Heart. I'm not a physician, so I'd be interested in Dr. Greer Hall's opinion, but you know, I've got 500 providers in my medical group, so I listen to their medical opinions on the test. And you know, most of them think there needs to be more controlled studies done to understand what the test really means, because we know it doesn't confirm protective immunity. We know that it has limited value in the immediate diagnosis of the COVID-19 infection. But we know there could also be some eventual value to see how widespread COVID-19 is, but that's still to be determined. And we also know there's value if there's any potential blood plasma donors too. So, you know, the antibody testing, I think, is a nice additional thing to have, but we're going to just continue doing the nasal swab. We want to identify those people with the positives, get them isolated, and prevent that spread.
Well, thanks. And, you know, let me just say here and take a pause to thank Community Health and Dr. Greer Hall and Justin, and thank you at Ascension. I mean, we love our other medical providers, and they're all dear friends, but 80% of the testing has been done by these 2 groups. And Dr. Greer Hall, you have literally gone into some of those marginalized neighborhoods, those at-risk places, and you've taken it mobile to neighborhoods, particularly in the pockets of poverty and distressed neighborhoods and those who don't have resources. So before you even say anything, let me just say thank you to both of y'all for your hard work. And Dr. Greer Hall, you know, that leads into what Justin just said. I mean, what's your thought of the antibody test and what in the COVID-19 and where we are, and maybe even address some of the myths and some of the facts about the test?
Well, as far as antibody tests that we talked about last week, we are still, like Justin said, trying to see what's the value. How do we use this test in determining those who have been exposed to COVID-19? And I think we're still trying to see what the CDC also recommends as far as the use of this test in terms of how can we use it in terms of determining those who have been exposed, those who do have antibodies. And then we don't know, like we mentioned last week, how long do those antibodies protect you from COVID-19? So we still have a lot of unknowns for the antibody test, and I think there's more to come with that. But those are available with the commercial labs to do. So it's just a matter of making sure, if you have one done, that the results of that test are interpreted, and that whoever has the test done, that they understand exactly what it means. But if you feel like you have COVID-19, we still recommend getting the PCR test with the nasal swab done to confirm you have it at this moment, because antibodies do not form for several weeks after you've had the infection. So that test we're still working on, trying to determine how to use it in the proper way. What community health we're doing, we're focusing on taking care of those in our community that are in underserved communities. We've gone to Addis Court, Morris Court. Today we're in Gonzales Court with our mobile unit. We're staying committed to our mission of taking care of those in Pensacola, in Escambia County and Santa Rosa County who are underserved, who do not have access to get to one of our testing sites. And so that's what we're focused on, and we're going to continue to focus on as long as we need to take care of those in our community. And we're even looking to go up into Century. We've been over to Milton. So we're taking our mobile unit on the road to get everybody tested who needs to be tested. And there's no screening required when we do this. We want anybody who feels like they need to be tested to come and get tested. There are those myths out there that we want to make sure we clarify. Now, everyone thinks because, you know, things are opening back up now, that the virus is gone. That is not true. The virus is still out there, and we want to make sure everyone continues to take those measures we've discussed in the past to heart. Make sure you continue doing what you've been doing, because the mall is opening back up and because things in the beaches open back up, that does not mean the virus is gone. If anything, I'm concerned we're going to see a spike in our numbers when things start to open back up, because people will start gathering again, and the virus is out there, and there's so many who do not have symptoms. You can't just look at someone and tell they don't have COVID, because you can have asymptomatic carrier state with COVID-19, meaning no symptoms at all. So that's one of the myths, that you can look at someone and tell they have it. You can't. You cannot tell who has COVID and who does not. And at least 20 to 25% of those with COVID may not have any symptoms whatsoever. So you have to keep that in mind. Another myth is that it's okay for us to start church services back in person. It is not okay for us to start church services back this upcoming Sunday. Yes, it's Mother's Day. I would love to go to church. However, I won't be at church this Sunday, and Pastor Yates already knows he's going to continue our virtual church services, and we hope all of the churches here in town continue the virtual church services until we know for certain it's safe for those services to start congregating, because there's so many in the church congregation that are so vulnerable to this disease, and we don't want our church members to get sick. So please do not start going back to church this upcoming Sunday. So that's one of the myths, that, yeah, it's time to go back to church. No, it's not time to go back to church. One of the other myths is, if you drink ethanol, methanol, alcohol, and bleach, that you can cure yourself of COVID-19 or prevent the disease. No, that is not true. These things, methanol, ethanol, bleach, they're poisons. So please do not, and disinfectants, please do not drink these to prevent or treat COVID-19 because that is dangerous. And so please do not do that. There are those who think sunlight and sun rays will kill the virus. That is not true either. So that's a myth that's been out there, as far as, if you expose yourself to enough sun, you can get rid of COVID. Not true. If anything, you're going to get sunburn, and that would not be good. So that will not prevent it. Also, there's this myth that I've heard, that if you hold your breath for 10 seconds or more without coughing or feeling discomfort, that means you won't be able to catch COVID-19. That is not true. Holding your breath for 10 seconds, that has no value when it comes to COVID-19. Those with COVID-19 can present with fever, cough, shortness of breath for certain, but holding your breath for 10 seconds will not tell you whether or not you have COVID symptoms or not. So that is not true with this virus. So those are some of the myths we hear about. There are other ones out there, that we've heard about, that the mask we're asking our patients and our citizens to continue wearing, it's not just for the safety. If enough people are wearing masks, we can continue to decrease the spread of this virus. So if you're wearing a mask, I'm wearing a mask, the chances of us giving it to each other are very unlikely. So we do continue to ask everyone to wear the surgical mask if you're in a healthcare center and you're a healthcare worker, or the cloth mask, because it will help decrease the spread. So we do want everyone to continue wearing these masks. And those, who are actually taking care of patients with COVID-19, we are asking, of course, to wear N95 and PPE to help prevent them. But the surgical mask and the cloth mask that others are wearing, we're asking that those continue to be worn to help you from spreading it to your neighbor. And it's only out of respect for each other that we ask everyone to wear this. If you're at the grocery store, if you're out shopping, wherever you are, wear your mask, please, because the virus is still out there. You may have it and not even know it. So those are just some of the clarifications and myths we want to clear up today. So
Dr. Griff, thank you so much. Thank you for clearing up those myths, because people watching late night TV and all the national news, and you hear those things. So you're saying right here, drinking bleach and going to the beach will not get rid of COVID-19.
No, it will not. It will not. If anything, going to the beach will, like I said, it's nice to get out, get some fresh air, and we're not opposed to people getting outside and getting some fresh air, but don't believe sitting and baking in the sun is going to stop you from catching COVID-19 or prevent it from happening. So.
Well, thank you. And you got that right here from a medical expert. I say, you know, politicians, we're tasked with making policies. And it bothers me many times when politicians would make recommendations about the healthcare. We leave that to Justin and to you. And thank you. I mean, in the great work that you've done with Sandra Donaldson and Sandra Smiley and getting out in the community is commended. Today, for you to educate us on the myths, I'm very grateful. And hopefully people are listening and taking your many years of school and your many days of prayer. And I often say when we talk about church and God is really using scientists and outdoor hygienists and medical professionals and doctors like yourself to give us the information that we need to be safe. And so I encourage people to continue to stay in, sanitize, isolate, and make sure that you're being safe. I mean, we want to be prayerful, we want to be mindful, but most importantly, we want to be safe. So in closing, Justin, is there anything you want to add? And then I'll let you close, Dr. Greer, and we will be moving on to the next segment.
Yeah, just two things. So, you know, one, I just want to compliment Community Health. You know, just an amazing organization. Now, I'll give you the disclaimer. I'm a board member, I'm their treasurer, and I've been working with them for 17 years. But between, you know, I would have never guessed 2 months ago that our two organizations would have done 80% of the testing. Community Health has been outstanding. We've been very complimentary. We have shared clinical staff in testing. We've shared back office staff. So I'm just very proud of them. They've done great work. The other thing is I want to make sure people know, don't delay getting your medical attention if you need it. You know, we're making the facilities a safe environment so you can receive health care. If you need anything at Sacred Heart, you know, go to getsacredheartcare.com to schedule appointments or call your primary care office. But that's the two things. Thank you, Community Health. And I look forward to our next board meeting where we can see people in person.
Yes, I know. That was nice.
Hey, I'm getting comfortable with these team Zoom meetings, man. You know, they're great. But just please thank Don and your entire team, Mike Burke and the Sacred Heart Ascension team. I had the opportunity of serving on the board many years ago, and just the great ministry that's happening there, not only during these difficult days that we're facing, but throughout the year and throughout our lifetime. We become dependent on our healthcare professionals and facilities, and Sacred Heart has always been there to serve. So we appreciate it.
Thank you.
Greer Hall, in closing, is there anything that's important that you would like to add before we end?
I just want to encourage everyone to stay safe, stay home, and stay well. And this will end. This too shall pass. We just have to all be patient. So be COVID smart in whatever you do. So I just want to encourage everyone, stay motivated. We can get through this.
Thank you, Jason Librado, Sacred Heart Ascension Chief Medical Officer, Dr. Greer Hall for Community Health. Thank you for joining May's message. To all of our friends who are listening, as she just said, stay safe, stay prayerful, but stay mindful and stay in your homes. Only when you have to go out is when you should go out. We are not out of the woods completely yet, as you've heard today from our medical advisors, but we will get through this together. Thank you, and God bless each of you.